UTIs can be very detrimental in the elderly especially. So that is one of the reasons that we really are putting high importance on decreasing these UTIs. We want to make sure that they meet criteria for the UA, and then also that they meet criteria for the antibiotic, and that it's the correct antibiotic if indicated. We do not want antibiotics to be used inappropriately. That can cause C. diff, that can cause multi-drug resistant to antibiotics, and so we're really trying to prevent all of those unnecessary complications from unneeded antibiotics. It was identified through data collection. Towards the end of 2020, they had noted that in 2019 and 2020 we had a total of 88 UTIs, and they had discovered that was a process improvement that we needed to start. Just around that time, I started in December of 2020, so we did then start with interventions. We put in a lot of interventions involving a lot of different departments. So hydration carts that are passed daily with the use of dietary and cranberry juice supplements. On admission, I look through the H&P labs of every admission, and if I find that someone has had a UTI or has had multiple UTIs, I send information to our dietitian, and she then orders that they get cranberry juice twice a day, and that is used to help prevent UTIs. We also use DMAOS, which is a supplement that's been proven to help with UTI prevention, and we use that on residents that do get frequent UTIs, and we have seen a significant decrease with UTIs for those that take that. On residents that have tried the DMAOS, they do the cranberry juice, they're still having a lot of UTIs. We do have a few that we do then implement estrogen cream, and we have seen success with that too. We also have ongoing discussion with our medical director, Dr. Stanley, and our ID doctor, Suchsdorf. They are on board. They are very supportive of the fact of what we're trying to do. We're trying to increase antibiotic stewardship and decrease UTIs. So they help with discussions with other physicians and communicating what we are trying to do here at Dunklau Gardens. A lot of one-on-one education with the medication aides and with staff, so educating them on the use of the hydration cart, the importance of hydration and encouraging fluids, the importance of good pericares and doing pericare observations and audits, the importance of, we have some residents that are at high risk that we now do showers only instead of baths, because whirlpool baths can increase the risk of UTIs also. So just really getting them on board with what we are trying to do and all the different interventions that we can do to help prevent the UTIs. So we also do education with the nurses on the use of the UTI SBAR, and they have done a phenomenal job with increasing the use of that. The importance of that is that talks the nurse through it, shows the nurse if the resident meets criteria for a urine culture. And then they fax it to the doctor, and then the doctor can then see if they meet criteria for a UA. This is important because a lot of elderly people they'll grow bacteria in a culture, but if they do not meet criteria, if they're not symptomatic, they do not need antibiotics. So it's really important to make sure that they meet the criteria in order to obtain a UA. Part of my role is to also monitor in real time the culture results. So when we monitor those, if they come back and they're negative, then I would reach out to the doctor to get the antibiotic discontinued. And if it comes back that the antibiotic they're currently on is not appropriate, then I reach out to the physician and we get it adjusted to an antibiotic that is covered and appropriate. So at the end of 2021, we ended the year with 46 UTIs. which was a decrease by 48% for the prior 2 years. The 2 years previous, they had 88 in 2019 and 2020. So we were very encouraged and very thankful for all of the hard work that the nurses, the med aides, dietary have put in to help with this reduction in UTIs. Currently, we are at 35 for the year. So we are still really making a decrease in the UTIs and just doing all that we can to help prevent those.